Hello students, in today's lecture I will discuss you about the folding or looping of your developing heart tube so that you will have the normal shape of a adult heart. Plus if there is a abnormality occurs in the looping, it will lead to a embryological defect is known as dextrocardia. So let's discuss about the folding of heart tube. Now when we are talking about the folding, now dear students, there are two numbers which you have to remember. One, the looping starts on the 23rd day and it completes on 28th day. Now once you are talking about the formation of the folding or looping of the heart tube, there are two things very compulsory. One is lengthening of the tube and second thing is formation of transverse sinus. Now what is the meaning of this? Now suppose this is your heart tube or any tube. Now if you want this tube to elongate, and the elongation is possible when the posterior side of the tube is become free. Now there are two ends of the tube, this end is fixed, this end is fixed, and posteriorly the tube is fixed. Now in this condition, if lengthening is taking place, then what will happen? This tube is no more elongate anteriorly, it will show the such spring-like saculations. So my dear students, when we are talking about the looping, the loop is formed only in the condition when this posterior part is not there. And when the two ends are fixed, posteriorly it is free. Now what will happen? It can form the loop. So whenever you are writing the looping, there are two very compulsory events. One is lengthening and second is the posterior border of the tube has to be free with the help of the formation of transverse sinus. So what will be the effect when you will see the looping? First, there is a formation of a U-shaped loop that is known as bulboventricular loop, and this loop is directed on the right side that I will discuss in the coming part of this lecture. And second thing, this loop is ultimately converted into the S-shaped structure, and finally what will happen that the bulboventricular sulcus disappear and it will form the adult structure of the heart. So my dear students, when you are writing the cardiac loop or the folding of your heart tube, there are two very important events which you have to understand. One, lengthening of the tube, and second, simultaneously formation of transverse sinus. So let's discuss them one by one. So what will happen initially? The heart tube placed longitudinally into the pericardial cavity. So that we know that initially the tube is a straight tube and it lies in the cavity. Since the cardiac tube grows more rapidly. Now see, there are two things, one is tube, one is cavity. Now if the cavity and tube are growing at the same pace, then tube cannot accommodate into the cavity because the cavity is also increasing in the size. But the tube is growing very faster, so the size of the cavity is smaller, tube is larger, so at the end tube has to fold itself to accommodate inside the cavity, and that's why there is a formation of helical loop and which is known as cardiac looping. Clear? So now the first concept is how the lengthening of tube occurs. Now for the lengthening of tube, you know that there are two heart fields I initially told you in my previous class, primary and secondary. Now this secondary heart field is important for the formation of your cardiac output areas. That means it is going to form your truncus arteriosus and your smooth part of ventricles. So my dear students, what will happen when you are having the tube? Now you know that tube is having the four dilatation, 1, 2, 3, 4. 1, 2, 3, 4. Now these two dilatations which are known as bulbus cordis and primitive ventricle. Now first the lengthening occur at this area, and why? Because of the cells arises from secondary heart field. Now the bulboventricular part grows faster than the pericardial cavity. Now what will happen? Because the end of the heart tube remain fixed by the pharyngeal arches at their arterial end and the septum transversum at their venous end, the elongation cannot take place in the longitudinal direction. Now what is the meaning? Now when you will see this tube, now initially what is happening that this tube is having this upper end, this is lower end. The upper end, we know that there are presence of the multiple aortic arch arteries or pharyngeal arch arteries which are connecting it with the dorsal aorta. So this end is become fixed. Now in the lower part, you will have the formation of septum transversum. So the lower part is invaded into the mesenchyma of septum transversum. So now what is happening that you are having a tube with the two end fixed. Now this part of the tube in middle of these two ends are is increasing in the length. So first what will happen, you have to fix the two ends of the tube. Upper end is fixed by the developing pharyngeal arteries and lower end is fixed by the developing mesenchyma of septum transversum. Now in this middle portion you are having the two chambers of heart, not the all four dilatation. You have only initially the two dilated areas of the heart tube. One is known as bulbus cordis, and below that you will have primitive ventricle. So in this area you will initially have the bulbus cordis and primitive ventricle, which are known as intrapericardial part of the tube in initial part, and the remaining two, that means the primitive atria and your sinus venosus, initially lies outside the pericardial cavity. So they are known as extrapericardial region. Clear? So initially you have, when writing the lengthening of the tube, there are three things which you have to understand. First, lengthening start at the arterial end because of the proliferation of the cells of secondary heart field. Second thing is that because the ends are fixed, how they are fixed? The upper end fixed with the pharyngeal arch arteries, lower end fixed with the mesenchyma of the septum transversum. Now the middle portion of this tube is increasing, but the upper two dilatations are intrapericardial and lower two dilatations are extrapericardial, which you can see in this diagram. Now here what you are able to appreciate, that this is your area of pericardial cavity. Now these are the two chambers which lies outside the cavity, and these are the two chambers inside the cavity, and when the dilatation is taking place in these different parts of the heart tube, the folding will start. Clear? So now there is one more simultaneous thing is taking place, which is known as transverse pericardial sinus. Now my dear students, what is the compulsion of the formation of this sinus? Why you need this sinus? Now see, again you try to understand that this is the tube. Now you have fixed this end into the pharyngeal arches arteries. You fix this end into the mesenchyma of septum transversum. Now posteriorly this tube is fixed with the dorsal mesentery, or you can say dorsal mesocardium. Now do you think this tube, if lengthening is there, can form the loop? No. Why? Because loop is a U-shape or C-shape structure, and for that the tube has to come out something like this. So because it is pulled by these posterior structures, it cannot go ventrally, it cannot form any loop. Then what will happen if lengthening is continuous? At the end it is become sacculated, or it will form a spring-like structure. Clear? So if I have to make a loop, if I want to convert this tube in this way, then what will happen? I have to make this posterior border free. And that's why there is a compulsion, or there is a need of the disappearance of this dorsal attachment of the tube, and this disappearance of the dorsal attachment is known as transverse sinus. So initially the tube is suspended to the dorsal side by a fold of the mesocardium, is known as dorsal mesocardium, and this dorsal mesocardium is also derived from the secondary heart field. Now here in this diagram you can see that this is your secondary heart field, and here there is a formation of this dorsal mesocardium. Now what will happen? Subsequently the dorsal mesocardium area rupture over the almost entire length of the posterior border of heart tube except the caudal end, and now what will happen, that the transverse pericardial sinus appears, which connect both the side of pericardial cavity. So now as a result, what is happening, the heart tube is left suspended in the pericardial cavity by the developing arterial and venous end. So once you can see in this diagram, when there is a formation of this space on the dorsal side of the tube, now this tube is suspended only by the two end. Upper end is known as arterial end, this is the venous end, and in this pericardial cavity you can see that initial two dilatation, that means bulbus cordis and the ventricle, is now forming a U-shaped structure because the posterior border is free. So now it is going more and more ventrally, it is invaginating inside, it is invaginating ventral direction. Clear? So if you are pulling it from the posterior side, it is not possible to go ventrally. So this is the important thing. There are two concepts which I told you. One is lengthening. Lengthening is required, and the lengthening convert into the loop only when the dorsal part of the tube become free by the formation of sinus. Now what is bulboventricular loop? As the heart tube elongates, it bends and gradually invaginates into the pericardial cavity, which I just told you. Now the cranial end first bend ventrally, caudally and right side. Now see, there are three terms: ventrally, caudally and right side. Now see, try to understand. Now assume that there is a tube coming out from your chest cavity. Now this is a U-shaped loop. Now upper arm of the loop is formed by your bulbus cordis. Lower arm of the loop is formed by primitive ventricle. So first we are talking about these two dilatation. Upper dilatation is bulbus cordis. Lower dilatation is your primitive ventricle. So when the loop is coming out, it is your ventral surface. So first ventrally. So first direction of the loop is ventrally. It is not going posteriorly, it is coming out towards the anterior aspect. Now it is this loop which is coming out, it is going to rotate right side, not left side. So it is going to right side. Clear? Now what will happen? Now this loop is having this anterior point, and now this point is going right side and downward. That means caudally. Now there can be the other possibility that this loop come out ventrally, then it loops go right side and cranially. But this tip is not going cranially, this tip is going caudally. So you have to understand what is the direction of bulboventricular loop. It first come out ventrally, then the loop will go right side, and then the tip of the loop faces caudally. It cannot face towards the upper side. Clear? The heart tube undergoes a right-handed looping. So what is the normal looping? Right-handed looping, which is known as dextral looping, and this dextral loop is now known as bulboventricular loop. So the right side of the heart becoming the outer curvature and left side becoming the inner curvature. What does it mean? Now here you can see when the looping is taking place. So this is your outer curvature, and this curvature is convex on the outer side. This is your bulboventricular loop, and this bulboventricular groove which is forming the inner curvature. Clear? So what is the tube? Now this is the, we are talking about the upper two dilatation. So this is your bulbus cordis, this is your primitive ventricle. When the looping is taking place, it is something like this. Clear? So when there is a formation of the bulboventricular loop, this is the outer curvature facing right side, this is the inner curvature which is facing the left side, or you can say concavity comes on the left side and convexity comes on the right side. Clear? Now what will happen? The resulting of the heart with the apex pointing the right side. Now what apex? I am talking about apex of your loop, not the apex of heart. We are here concerning about the apex of loop. So where is the apex of loop? Now this is the apex of the loop. Clear? That is this point which is a junction of bulbus cordis and primitive ventricle. Clear? So now my dear students, you have to keep this direction always in mind, that when we are talking about the formation of bulboventricular loop, why the bulboventricular loop is forming? Because this area grows very faster because of the secondary heart field cells, and when this is growing faster, it comes out on the ventral surface, and this sulcus which is here, that is known as bulboventricular sulcus, is going to shift on the right side and downward. Clear? So this is what is the formation of bulboventricular loop. Now what will happen is that this U shape convert into the S shape loop. Now how the S shape will form? Now we know that the primitive atria and the venous sinuses are lies outside the pericardial cavity initially. So now when the S shape loop is convert, now what will happen that they are pulling. Now this area is pulled inside the pericardial cavity. So first there is a formation of this shape of the loop. Now what will happen that this loop is pulling the remaining two chambers or two dilatation inside. So what are these? This is your atria, this is your sinus venosus, this is bulbus cordis, and this is your, this area is your primitive ventricle. So what is the sequence in this S-shaped loop? This is bulbus cordis, then you will have primitive ventricle, then this is your atria and the sinus venosus. So this is the formation of the S-shaped loop. Clear? Now when this loop is taking place, what you are able to understand, that this is the anterior part of the loop. That means the ventricle develops on the ventral surface and your atria goes dorsal to the ventricle and atria goes in the upper part of the loop. That means now atria are dorsal and cranial. Clear? They are cranial and dorsal, and ventricles are anterior and caudal. Clear? So when you will see this adult heart, now in these adult heart, what you are able to see, that ventricles are appear on the anterior surface while the atrias are appear on the dorsal surface. Plus you can see atrias are on the upper part of the heart while ventricles are in the lower part of the heart. Why? Because I just explained that once there is a formation of a U-shaped loop and then it will convert into a S-shaped loop, and when you will see the sequence from here to here, this is your area of bulbus cordis, then this is the area of your primitive ventricle, then you will have this primitive atria, and then this is your sinus venosus. Clear? So now this is the tube. So here you can see that this ventricles lies anteriorly in the lower part. So you will have anteriorly and lower part. The atria are dorsal to the ventricle in upper part. So atria are not on the anterior surface, you can see dorsally and in upper part of adult heart. Clear? So my dear students, this is the importance how the U-shaped loop convert into the S-shaped loop. Clear? So now initially the bulbus cordis and primitive ventricle separated by the bulbo-ventricular sulcus. That means initially there is a separation is there, that we know, but later on the sulcus disappear, and once the sulcus is disappear, what will happen? There is a formation of the chambers of the ventricles and it will establish the external appearance of heart. Now what you have to realize, you will realize that once the looping is completed, all the four chambers will get their adult position. Now what is the adult position? You will realize that in adult position, your atrial chambers lies above and behind, that means dorsally and above, and ventricles come in front, that means ventrally and below in your developing heart. Now the applied is dextrocardia. Now students, in the dextrocardia you have to understand that this is a normal looping where you can see that this bulboventricular loop is having the right side outer curvature and left side inner curvature, and because of this reason you will have the right side folding, and because of the right side folding the left ventricle comes here and right ventricle comes here. But if this loop will have the reverse looping, now because of this right, you will have right ventricle on the right side and left ventricle on the left side. But if this will go on the left side, what will happen? This right ventricle comes on the left side and this left ventricle goes on the right side. So normally left ventricle should come on the left side. Here the left ventricle is going on the right side. Why? Because this loop which has to rotate right side rotates left. Clear? So what is the dextrocardia? Dextrocardia means if embryological heart tube bends to the left side instead of the right, there is a displacement of the heart and you will have the formation of the mirror image. So now the left ventricle is not present on the left, rather than the left ventricle comes on the right side. Now this dextrocardia may associated with a one more situation is known as situs inversus. In the situs inversus, your abdominal organs also shift opposite side. That means your lesser curvature shift on the left side. So this rotation to the opposite side is known as situs inversus. So abdominal viscera are also having the mirror image. Now this heart of dextrocardic heart may function normally if it is not associated with the any other cardiac anomaly. Clear? So now at the end of this class, what you are able to understand, that whenever we are talking about the looping of heart tube, the most important two events are lengthening of the tube, and second, it has to be free from the posterior side by the formation of transverse sinus. Second thing is that once the transverse sinus is formed and lengthening will occur, the lengthening first start at the upper end or the cranial end, and the lengthening increases the size of your upper two dilatations, that means bulbus cordis and primitive ventricle. It will form a bulboventricular loop, and direction of loop is ventrally, then right side and downwards. Now later on what will happen, this U-shaped loop convert into the S-shaped loop, and when the S-shaped loop is formed, your atria will goes dorsally and the ventricles come anteriorly. Clear? And lastly, if this loop which is going right side will go on left side, then it will lead to a condition is known as dextrocardia. So this is all for the session. Thank you.